One.
Hello, everybody. Good afternoon, and welcome to our weekly media briefing. Once again, I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. And members of the media, do remember to ask permission for recording on the chat and also to pose your questions. A reminder to participants that this briefing is to answer questions from members of the media. Today, we will be focusing on the uptick in cases in the county and also on elections. Dr. Gale will not be joining us today, but we do have our county executive, Marc Elrich, Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security, and Dr. Gilberto Celaya. He is a Community Engagement and Public Information Officer for the Board of Election. So with that, we'll open the forum with a statement from our county executive, Mr. Elrich.
Okay, so good afternoon, everybody. I'll start with the COVID update as usual. I think you know from reading the media out there that cases are going up both nationally and around the world. France has just ordered a reclosure and a curfew in Paris and I think 8 other places. And so we're seeing the second surge of this that people said would be coming in the fall. It certainly appears to be coming. We've been talking with our public health officials about these upticks and what things may be causing them and what, if anything, we're going to need to do to make sure that our cases do not spin out of control. Our case count today was 89, but our case count yesterday was 107, and then Tuesday was 121. This trend isn't really a trend because we've seen this on a week-over-week basis. We get some low days and we get some spike days. Our test positivity rate has stayed relatively low at 3.2%, but last week at this time it was 2.9%, so we've had a slight increase and still below the state numbers. But our cases per 100,000 just in the last 7 days ticked over 10. And 10 is the point where you don't want to be. And that, above 10 means that you've gone into, by the CDC standard, high transmissiveness rather than medium transmissiveness. So we're monitoring this very, very closely. It was August 2nd was the last time that our cases per 100,000 were above 10. And this is as an average, it's not just one day. So again, this is something we're watching very closely. We're looking very much at the contact tracing data. We still see outdoor and indoor gatherings where transmission is occurring, as well as family gatherings, as higher level triggers of cases. The county goal is to test 5% of the population per month, but we've been actually around 11%. And remember that when you look at county-supported test sites, we only make up 10% of the total tests that are being conducted. So there are a lot of tests being conducted at clinics, at doctors' offices, hospitals. So there are a lot of other people actively testing right now. When we looked at the percent of cases by job categories, which continues to be one of the things we've been talking about, we find that 20% of people said they were employed in non-public facing jobs. We had 15% were in public facing dining. About 12% were, it's very hard to read this sideways, were restaurant, and another 12% were in manufacturing and, trying to read this word, bear with me, construction. And so those were the biggest in the group, and the next was just healthcare at 11% and retail in general at 9%. So those are the highest categories. It doesn't mean that people got COVID there, but it does mean that these are where at least people have said they work. And we think it's important to look at where they work, not just where they live. It is hard to discern whether a person caught a case of COVID when they were back in their neighborhood, or whether they got that COVID case when they were on the job site. We know that a number of these jobs, particularly construction, mask wearing is not something that is done at the level we would like to see. Our testing numbers continue to be strong, but we can never test too many. We continue to encourage everyone to get tested. Yesterday we tested 1,081 people, and we expect to be around these numbers as the week goes on. We continue to establish partnerships with community groups, and these partnerships are helping increase the number of people tested. I'll note that the minority health initiatives have been able to begin working with some of the nonprofit housing developers to bring testing into those communities. For more information on testing, you can go to our website for the locations and times, and I encourage people to get tested. It is critically important that people do this. Our test positivity rate, like I said, is the encouraging part of this, but 100 cases a day, continues to mean that people are going out and getting infected by other people who they most likely do not know are carrying. And so we need to get everybody we can possibly get tested. I'll just say briefly that we're going to talk a little bit about elections today. We are weeks away from Election Day, and today we have Dr. Gilberto Zelaya from the Board of Elections to talk about voting. Voting, obviously, in a democracy is really important, and I encourage people to vote early if they can. There will likely be lines, so please use the ballot boxes and the mail-in ballots. You can still get a mail-in ballot, so if you haven't done so already, please request it. On a different note slightly, biotech industry continues to grow in Montgomery County. We've been actively recruiting and working with people, and we're going to announce today that Autonomous Therapeutics has chosen Montgomery County for its new headquarters. They're relocating from New York City, and they're relocating to 17,700 square feet on East Jefferson Street in Rockville, which is also in an opportunity zone. The new ATI Rockville headquarters will be home to the R&D, manufacturing, and clinical studies that will move its COVID-19 and influenza therapeutics into clinical trials and eventually the marketplace. And currently the company has 15 employees with plans to hire 50 more scientists and engineers within the next 3 years. So they're going to receive an $80,000 Montgomery County MOVE grant, as well as assistance from the City of Rockville MOVE grant. And they're also eligible for job creation tax credits through the state of Maryland. And with that, I will turn it over to Dr. Stoddard.
Good afternoon, everyone. I want to thank you all for coming back and joining us again. I do want to emphasize one point that the county executive made, and I think it bears repeating. Our cases per 100,000 today is at its highest point since August 2nd. That's multiple months that we've been waiting. We've been trying to get this number down, and it has gone up to that point again. As a reminder, the 10 per 100,000 threshold is the threshold where the multi-state conglomerate, including New York, New Jersey, Connecticut, have typically put out travel advisories related to the states in which they reach that level. And so obviously it is incredibly concerning to us. And, we're not at the point of, alarming. We're in phase 2. We're not moving back yet at this point, but we're obviously continuing to look at those numbers and figure out exactly what we can learn. We are, however, we're preparing an update to our executive order this week that would have allowed for some additional activities. We are putting that on pause while the public health team does investigate this uptick in cases to understand exactly what the cause of the uptick is. There are also considerations that we are making for things like live performances that are now being paused as a result of this uptick in cases, where we need to investigate and find out exactly what the causes are before we feel comfortable moving forward and sending out the potentially mixed messaging that we're seeing an uptick in cases, but we're opening more things up. So obviously those things are big concerns for us. For the late night permit program, we're over 200 participants in that. We did have, not related to the permit program itself, but we did have 2 citations that were issued to businesses this past weekend for lack of physical distancing and face coverings. This continues to be a concern that we have, and one that we're focused a lot on. In addition, we've been working with our Chief Equity Officer, Tiffany Ward, to take a look at our enforcement programs related to COVID-19 to make sure that they're being done in a racially equitable way across the county without being particularly focused or disproportionately focused on any particular location, ethnicity of business owner, anything across the board. And so she's been working with us to make sure that we can build in checks and balances to make sure that our COVID enforcement measures are being done in the manner that we absolutely believe is the fairest to all across the county, while also being protective of all of our residents and workers across the county. We are looking at guidelines for aerosol transmission. As you all know, CDC added aerosol transmission over the last couple of weeks to the list of concerns related to COVID-19. We have developed some draft guidelines that we are working with some HVAC industry representatives to vet to see whether they're achievable for Montgomery County businesses and properties, including county government. And when we should have more to talk about next week, but we are meeting actively with those HVAC industry representatives to make sure that we can add additional guidelines where appropriate. Finally, we are continuing to work with our non-public schools. We had a meeting last Friday. We continue to work with them. We'll continue to have meetings throughout the fall to try and maximize the opportunities for safe schooling. I do not have the full update for today that Dr. Gales would normally provide on the investigations associated with the schools. We can certainly provide that hereafter. I think we still remain at least 2 instances where we have had cases in schools result in a suspected transmission event based on others who were quarantined developing cases, but we'll need to have an update after this call for those numbers when Dr. Gales returns. I think that's all I have to say, and I will turn it over to Dr. Zelaya.
Good afternoon, everyone. First and foremost, I do thank County Executive Elrich allowing us the opportunity to join this briefing. Quickly, the mail-in ballot request deadline is a received deadline, and it's coming up. It's this coming Tuesday, October 20th. So by all means, please submit that request as soon as possible. That will mitigate lines during early voting and or on election day. You can easily do it on your cell phone. Text the letters VBM for Victor, Bob, Mary, VBM to 77788. And in Spanish, the word is buzón, B-U-Z-O-N, to the same number, 77788. So once again, the receive deadline is not a postmark deadline, it's a receive deadline of Tuesday, October 20th. In addition, also want to communicate that we have now a total of 42 ballot drop boxes available for voters to deposit their mail-in voted ballot as of today. Please visit our website at 777vote.org for the latest information. But once again, you could text the word box and your zip code. That's box, B-O-X, and your zip code for the closest 4 ballot drop boxes. And it also gives you the USPS post office and collection blue bin locations according to your home address. So it's a great tool to use to facilitate that information. And in Spanish, the word is buzón, B-U-Z-O-N, and your zip code for the 4 closest ballot drop box and locations, address, and driving directions. Also want to know that we are canvassing. We're in day 4. We highly recommend individuals to join us via live stream. As of today, we have received a total of over 370,000 mail-in ballot applications. We have processed in-house over 351,000 applications processed. And we have scanned in over 80,000 as received. So if you text the word check, C-H-E-C-K, to 77788, once again, check to 77788, you can see the designation of your mail-in ballot as received. And in Spanish, the word is revise, to 77788. And lastly, we have canvassed over 50,000 scanned in mail-in ballots. So we're working our fingers to the bone. We're here to serve, and I really appreciate the support from the county executive and our voters.
All righty, thank you, gentlemen, for those opening remarks. And we have the first couple questions that are coming from Chris Gordon, NBC4, for the county executive and also for Dr. Zelaya. Chris, unmute.
Yes, I'm doing that right now.
There you go.
First of all, Mr. County Executive, thank you for adding Dr. Zelaya in. For those of us who have worked with him, he is tireless, he is straight to the point, and I'm sure we would appreciate continued access to him as we go forward with their weekly COVID updates. So I have one question for each of you. To the county executive, I just wanted to get your reaction to this theory being discussed right up to the White House about exposing people to COVID for herd immunity, and also the pushback from Montgomery County Council, or some pushback to $50 million paid by the county as hazard pay to essential workers during COVID. And for Dr. Zelaya, have there been any problems? Do you foresee any problems in the process of voting?
So I guess in reaction to herd immunity, I think it's a pretty insane idea. You know, it might be okay with cattle. It's not okay with people. You know, to achieve herd immunity, you basically have to infect the herd. And I guess that's a really crude way to think about human beings. And to infect the herd, you'd have high levels of infection, which means you're going to have, you know, levels of death that dwarf what we've experienced already. I mean, if you took, you know, a 60% number of the Montgomery, of the state or national population, and then said those many people have to be infected to get herd immunity, and then you multiply that times the number of people who are infected now, and then multiply that ratio times the death rate right now. I mean, first thing you do is you'd overwhelm the hospitals. That would just be the starting point. And if the hospitals get overwhelmed, the quality of medical care goes down and the death rates climb. It's just a prescription for mass death. And this is their alternative to being patient enough to wait for a vaccine to come on the scene, which, you know, the president thinks is imminent. So why one would think about infecting the herd when you're going to get a vaccine is really ridiculous. And then there are going to be treatments coming. In fact, you know, some of the decline in death rates has probably come because of improved treatment as people have learned more about the disease and how to fight it. So I just think it's crank thinking. And basically these people are calling for mass death of American residents. I'm not sure that the American people would go along with that. On the other issue of the pay, this county was in a position where a long-standing contract with the unions had us paying double time for emergencies, and the governor declared emergency that qualified for that pay. We went to the unions and said, there's no way we can pay double time. That's not possible. So we negotiated it down for front-facing workers, and then and an even lower rate for non-front-facing workers. But we've also got a lot of people, you know, who are working from home who aren't getting the differential because they're doing the work from home. And we did that to the greatest extent we possibly could. But these are people who show up at work every day. And often, you know, the whole point of the front-facing was these people are dealing with the public. And if you remember what this was like during the first couple of months and the amount of sickness that was out there and the caseloads that we were having, we were putting people in harm's way. And, you know, the employees, because it's part of their job, went to work in harm's way, but they expected to get the differential for emergency pay. So, you know, the unions negotiated it down to, we were able to negotiate them down to the split we got. It probably would have been differently looked at if we had not had that contract provision and we weren't still under, and if we weren't still under executive order from the governor, but we are. And again, you know, we're looking for reimbursement from FEMA, and we'll see what gets reimbursed. And as always, we continue to relook at things as our financial situation changes.
Thank you.
And as a per se, as a follow-up to Chris, we're foreseeing a smooth election. We are asking our civic-minded voters to make a vote plan. Once again, several weeks ago, a sample ballot was mailed to every single registered voter. If you need to download a copy, please visit our website at 777vote.org. You have multiple options to exercise your right to vote. We highly encourage voting by mail, which will mitigate lines on election day or during early voting. And if you do request a mail-in ballot, by all means, please follow through and vote that ballot. If you do show up and change your mind to vote in person, you will need to vote a provisional ballot. No ifs, ands, or buts. And that's going to add a considerable amount of time to your voting experience once you check in. So please follow through with your voting ballot requests, vote your ballot, return your ballot through the post office or one of our 48 ballot drop boxes by texting the word box and your zip code, and in Spanish es buzón and your zip code, or make your request as soon as possible with the letters VBM to 77788, or in Spanish, VPC.
Okay. Rebecca Tan from the Washington Post with questions for Dr. Stoddard and also for the county executive. Rebecca.
Thank you, and thank you for doing this. My question for the county executive and Dr. Stoddard, you mentioned that there were some restrictions that the county was considering lifting for this week, but have now been put on pause. Can you tell us what those restrictions were? And my second question is, you say, we know that there's currently an uptick of cases in the county. Have you seen any indication that hospitalizations or other metrics are going up as well? And related to that, at what point would the county start to consider rolling back some of the restrictions that have been lifted in the same way that we've seen happen in parts of Europe?
Want to start, Earl?
Sure. The executive order was going to allow certain activities around escape rooms. There was going to be some additional clarifications around parents and at youth sporting activities. We had been preparing at least a preliminary letter for our live performances to allow them to operate in parallel with what the DC pilot currently does, which is 50 performers plus audience members. And, obviously we're not necessarily saying we're not going to do those things, to be clear, but we're pausing them for now while we investigate exactly the cause for this uptick to see exactly categorically where we are seeing an increase in cases. We have gotten some public health data. We're waiting for other public health data to come from the state on the recent uptick. We get it periodically, and it just hasn't the last week come in all cases. And so the public health team is reviewing those to understand exactly what the causes of this increase are. I mean, it is an increase that we're seeing across the country, and so it may not be something that we can put our finger on, but we want to make sure that we're moving forward prudently and not sending the wrong message that, if we move forward in some areas but preach that there are this surge in cases in others, it sends a mixed message that we're just not comfortable sending. Now, the question of when we might consider moving backwards is not just a Montgomery County conversation, it's a regional conversation. We are reaching out to our respective counterparts. The county executive can talk to, plans to talk to his counterparts. I'm talking to my emergency management counterparts across the region. And similarly, Dr. Gales and Dr. Bridges will be talking to the health officer counterparts across the state and region as well. But I think obviously, when we start to approach things that are, it's not just the number of cases, but the rate at which they're increasing. If you look at our current charts, the slope of the lines is changing. And I think if we saw that sustained for a period of weeks, let's say another 2 weeks, I think we'd be having much more serious conversations about where exactly we were. In addition, I think it's like, as you alluded to, it's going to come in the context of hospitalization and other things. We know that hospitalization always lags increases in cases, meaning you'll see an increase in cases today, and you may not see the increase in cases for hospitalization for 2 weeks. But simultaneous to that recognition is if you do a change today, you won't see that change in hospitalization rate decreasing for weeks 2. And so we like to be ahead of increase in hospitalization rate because number one, we don't have a huge hospitalization buffer. And number 2, we recognize that when we make changes, it will take weeks, potentially up to a month, to see those translate into hospitalization reductions. And so we don't want to go too far into seeing increases before we act, even if we haven't seen hospitalization increases, just because we know in this pandemic they have lagged one another.
Sounds good. And County Executive Elrich, do you have anything to add?
No, I think that, I guess the highlight is, we're looking at what is happening in terms of case growth, because, our goal is to avoid the spikes that other people are having. That is a territory we do not want to go into. And so we're going to do what we can do to make sure that if we have to ratchet things back, that we're able to do that. And I hope, we're not the only government. And this is one of the problems is, this is where it'd be so nice to have the same national policy on this. But what Montgomery County does, it doesn't do in a vacuum. And it's really important that all the jurisdictions here come to grip with the same set of facts and the same conditions. If one of us or all of us are starting to see increases in cases, the likelihood is that we actually fuel each other. We talk a lot about how there's mobility across borders and people, travel from one place to another, work in different places. So none of us are immune to the effects of something that's happening, in a neighboring jurisdiction. And we really need to, I think, think about this collectively. It's, part of the reason that Montgomery County and Prince George's County and the district have been pretty well aligned with their policies is because we recognize the interrelatedness of our three communities in particular. But I think it's a bigger question for the state as well.
But Rebecca, just to give you some more context, because I just looked up the data. So our 3-day rolling average today is 86 hospitalizations, and the last time we were at that level of hospitalizations was August the 12th. So it's been similarly, a few months since we've seen this level of hospitalization.
Okay, thank you, gentlemen. Just a reminder, participants, this forum is to answer questions from members of the media. And the next question comes from Kevin Lewis, ABC7, Director to the County Executive. Kevin?
Hi there, County Executive. I was reading an article earlier today where the County Council on Tuesday took issue with the amount of rental assistance that has been handed out. I believe Councilmember Navarro made a statement that there had been 607,000 doled out of the 20 million allocated, and just wanted to ask you about that. I know that was something important to you and the council.
Yeah, I think, I used to be a legislator, and it's the best job in the world because you can just say, I want to spend this money and tell somebody to go spend it, and you don't actually have to figure out how to do it. And that's the job of the people who work in the county government. And this is that we've been dealing with from the beginning. I wish it was simple just to put more money out more quickly. But, the council appropriated the money, I think, at the end of July. We had the program rules and everything in place on September, I think it was September 9th. It took time to set up what are the criteria going to be, because the criteria can't be anybody who asks for money gets money. And so we set a criteria, tried to adjust the families that were most in need, looked at communities that were most in need, have to establish what kind of information people have to bring in. And because we are faced with, a couple of other things, if we don't do this right and we get audited by the federal government for the CARES Act spending, and we do not spend money on eligible people, then we are going to be responsible for paying back that money. So we have requirements for people providing information. And then once we had the program together, we had to go out and advertise it and promote it. So we're doing all that. But this money does not go to tenants. And so if people think that, somehow people aren't getting money that would flow to them, this money ultimately flows to the landlords. This is money for people who are arrears on their rents. And so when we put that money out, it'll go to the landlord of the property on behalf of the tenant so that when we get down the road to January, when evictions may well open up, we have as many people protected from evictions as possible. So I felt that our folks did the right thing to take precautions. I'll note that of about the first 1,100 applications or so, half of them were ineligible. And if we didn't have the criteria in place, and if we didn't have the requirement to collect data in place, and the county had simply given out money because people said, I need the money, we would have been seriously in trouble for just half of the initial requests for money. Some of the people didn't live in the state of Maryland. Some of the people hadn't actually experienced loss of income. I meant living in Montgomery County. I don't know if they lived someplace else in the state, but they weren't living here. Some didn't experience a loss of income. Some didn't meet the income eligibility guidelines in terms of their families as a whole. And so if we had just been careless about it, then we would have had a problem there. The other thing is our workers, in a lot of places, if you submit an application for something and your application's incomplete, you lose. You just toss the application, didn't provide the requested information, and you move on to the next application. We weren't doing that. Our workers have been contacting people whose applications were incomplete, talking to them about what kind of data they need to submit, helping them get what they need together so they can provide us the information so we can rule on their eligibility. So people have had to do a lot of things. Some of it slows down the process, and part of it was creating a process that would protect us from fraud and abuse and make sure that the people who really need the money get that money. So yeah, I wish you could do this instantly, but none of us were running programs like this before. And when we ran a program, we ran it with our own money. We face our own set of risks, but when we're running a program with federal money and they have the ability to take it back if we spend it wrong, we really have to get it right. The issue should be whether we're going to get this money out to people by December, and I'm not worried about that. They are already up to, what did I get this morning? They've already received 3,800 applications. They're getting about 100 every day. They've distributed about $1 million so far, and awards of about $4,000 each. And I fully expect this money to go out. And the other thing they have to do is hire people. We didn't have the staff to process all these applications. So we've had to go out and hire additional people so we can process the applications. So yeah, it's slower than I'd want in the perfect world, but this is far from a perfect world, and we have to make sure we do this right.
Thank you. That's very helpful.
Thank you.
Thank you.
Kate Ryan with WTOP has questions for the county executive and also for Dr. Zelaya.
Okay. First, for the county executive, will there be more frequent updates in terms of where you are in the process of getting money out the door? The council said one of the things that bothered them was a lack of communication. They also questioned that you weren't there the other day. And for Dr. Zelaya, what we've heard from Dr. Stoddard here in terms of the next couple of weeks being critical, do you have concerns that we could see the election affected by any future need to roll things back?
So let me start, Kate. First of all, we were doing a routine briefing to the council. Rich had met with council staff. They had gone over, some of the questions, of which the questions that came up in the meeting were not the questions that Rich was briefed on. And at no point did anybody ask me to attend. Council staff did not say, can the county executive come over? I had talked to the council president between last week and this week. He didn't say anything about coming over to the meeting. I was on the council meeting in the morning. I actually presented a joint proclamation that morning. There were no texts or emails to me saying, Mark, can you come to the meeting today? I don't normally go to the meetings. I had no reason to think this was going to be an unusual meeting since Rich had already been, kind of briefed by council staff. So I don't know why they expected me to be there. And if they did expect me to be there, they might have reached out and said, can you come to this meeting this afternoon? So that's one thing. The other part of your question was refresh me on your first part, because it wasn't the meeting bit. Oh, it was the updates. So as Rich pointed out in the meeting, and we're happy to share with you, we provide a weekly spreadsheet on all the spending by line, not just one number, by line, by program. And so the council's been getting these, I don't know for how many weeks now, but the answer is at least for weeks. And so you can see what the allocation of the department was and what the spend rate was. So if somebody had a question, there's been plenty of opportunity to just say, hey, you know, I see this line hasn't been spent down now. What are you doing and what's your plan for spending the money? That, you know, that's how I would have approached it. It is October after all, and the money has to be spent by December. And the money that, you know, particularly the housing money, is not money that residents are going to be getting. It's going to be going to the landlords. Just a simple question is, you know, I see that, you know, we're in September 15th and you've only now just started the advertising. Can you explain to us what you've been doing? I mean, which our staff would have been able to answer. But I don't know how much more frequently you can get briefed than once a week in a spreadsheet. I read the stuff people send me.
We have also added council staff to all of the briefings where we would work on all the financial issues as well. So they should have, they will be hearing it as we hear it on updates. So they should have, hopefully they will have no additional concerns about the frequency of their updates.
Got it. And to Dr. Zelaya, can you answer again? If Dr. Starter was saying next 2 weeks will be critical, the election is in 3, should people be concerned?
Well, we have our checks and balances, and we're preparing for election day during early voting and on election day, November 3rd. So my recommendations, if individuals have any type of concerns regarding COVID-19 rates increasing, infection rates, you have the mechanism called mail-in voting. So please request your mail-in ballot as soon as possible. Once again, the receive deadline is October 20th. Text the 3 letters VBM to 77788, or in Spanish, VPC to the same number. Submit it as soon as possible. We will do our due diligence to process and to mail your corresponding ballot as soon as possible, so then those concerns will not exist as it pertains to voting.
Got it. And can I just clarify one thing with you, Dr. Zelaya? You said, look, if you applied for a mail-in ballot and then you show up, you're going to have to vote provisionally. Is that correct?
Yes, correct.
Thank you.
You're welcome.
All right, we have one more question for Dr. Stoddard from Matt Gaffney, Fox 5.
Washington football team prepares to face the New York Giants defense that ranks last in the NFL.
Kate? Okay.
Thank you. Yeah,
Yeah.
I'm here. Can you guys hear me?
Yes, we can, yes.
Okay, great. Thank you, Dr. Stoddard. I just want to follow up when you mentioned that part of the pause for the executive order included parents at youth sporting events. So I know that like the Soccerplex and Sam Soccer had put out an advisory, I guess, to their folks about the new spectator policy that's due to go into effect tomorrow that would impact this weekend's games. Is that still in effect? Does that have anything to do with this pause in the executive order?
I don't know what the new spectator policy for the Soccerplex is. We certainly could follow up on that. Essentially, what we were going to allow is, particularly for the larger events with larger numbers of players on a team, staying within the 50-person limit was difficult when you added in parents and guardians, and so we were going to have an allowance to allow them to exceed that. So long as they followed the distancing rules. What we were finding is that parents, even if they were excluded as part of that 50-person limit, were congregating in the parking lots or just beyond the fence line so that they weren't really within the gathering. And then they were doing so in a manner that really wasn't consistent with good physical distancing practice.
Okay.
So what I would say to the Soccerplex, generally speaking, is the executive order will not be modified in time for the weekend. However, generally speaking, I would say, if they follow the distancing rules, I don't expect that we're going to be out and, issuing citations this weekend for people who are in good faith following the rules with physical distancing, with face coverings, and if they are the parent or guardian, not extended family, not friends and other relatives, right, observing soccer or any other sporting events, I think that they could do so responsibly and would not have any issues from the county.
Right. They're saying that the new policy, which they say is
they've worked with, Montgomery County Health and Homeland Security and Emergency Management. They say it's a one parent / spectator per player that could be on the sidelines, and they're in a socially distanced manner with specific dashes painted on the sidelines where they can stand. And again, including no more than 50 players, coaches, or officials on the field or in the bench areas.
They are fine to proceed with that, yes.
Okay, great. Thanks so much.
Okay, one more question from Brianna Adikusuma. Oh, I did not pronounce it correctly today, Brianna. Adikusuma. Yes, I think I did. From Bethesda Beat, and questions for Dr. Stoddard and also for County Executive Marc Elrich. Brianna.
Yeah, great job as usual with the last name. So I had a couple questions. First, does the uptick in cases mean it's potentially the start of another surge for the fall? When are you expecting and preparing for another surge to happen? And are we closer to putting restrictions back in place than moving to phase 3, you think? If so, where would you all be looking to put restrictions back in place?
Marc, do you want to start, or certainly I can?
I guess what you try to do is unwind from how we added things on in the first place. And, the truth is that every single thing you do adds cases, because anything you do that adds contact points, opportunities, for, people to come in contact with each other, increases the risk of transmission. You can't avoid that. And, since we're obviously not going back to our houses with no one going out at all, there are going to be contacts. So I would envision that, we'd probably start by reducing the more risky things. We know from the state, contact tracing, that indoor and outdoor dining continue to be something that shows up when you do contact tracing as something that people participated in. We might look at reducing, outdoor dining to 25% of capacity from 50% of capacity, just to help deal with that. Something that could mitigate that, not in this instant, is to the extent that we collectively, between the business owners and health professionals, determine are there ways to actually move the air inside these indoor confined spaces in a way that minimizes risk. I mean, we've done a lot of looking at, what the problem is. And the problem is basically that these aerosols linger in the air, which, the CDC is finally confirmed. And that adds to proximity of, people being 6 feet apart, which is no longer, just stay 6 feet apart and you'll be fine. It's probably more than that. So we've been looking at, what are the mechanics that would need to be done on air handling systems in buildings in order to improve air exchanges and minimize the likelihood that a person be exposed to air with coronavirus in it. It won't eliminate it, but it certainly could, reduce it. So there may be a technological solution, but it's not something anybody's going to turn on tomorrow and be able to implement. So while we're thinking about what we might close, we're also thinking about what do you do? What could people do that would actually make environments that they're in safer? We had, alcohol sales to midnight originally. We closed them back down till 10 because people weren't following the rules. If we wind up with people not following the rules again, I'm certain that we'll decide that we can't do the alcohol to 12. This is one of those things that people are going to have to be very, very careful and diligent about if they want to keep it. It could be the size of gatherings. And because we know that one of the other things that's identified in contact tracing is large social gatherings. So we might make decisions to shrink the size of what we decide is an acceptable social gathering. We're not talking about going back to lockdown, but we are talking about going back to a more restrictive environment. And I want to emphasize, Dr. Gales would do it if he was here, but I'll do it instead. Our cases now are higher than they were when the governor decided to go to stage 2 or to stage 3. And that's important to note because we've had these numbers before. And when we had these numbers before, the governor and his medical staff and everybody said, do not open. So we're back at a point when people would not have made a decision to open 4 and 5 months ago. I guess that's right, Earl. So here we are at a place that wouldn't have gotten us to open in the first place, and we're open. Where do you need to go to be safe again? And I think, our people have done a good job. You can look at our numbers. We, as a large jurisdiction, we're doing, really well. The positivity rate is still good. It's under 5. It's, around 3, but it was in the mid 2s. The cases per 100,000 have crept up. Part of that's, result of testing, but I'm not going to blame testing. All testing does is reveal the extent of your problem. Unlike a certain elected official who thinks he can solve his high case rates by not testing people, we actually want this information. And so we weigh that as we're looking at the decision we make. Yes, we're getting more positives. Yes, we're testing more people. What does it mean? And the thing I'll remind you finally is, I say this every week, if I'm averaging 100 cases a day, that means 100 people every day had been exposed to somebody who had COVID and probably didn't know it. That is the problem with this virus, in the first place. If you're not blowing symptoms, and you've got COVID, you're spreading. When the flu's going around, pretty much if somebody's got the flu, you knew they got the flu. You don't want to be anywhere close to them. And it's really obvious why you don't want to be close to them. With coronavirus, you don't necessarily know that. Feel free, Dr. Stoddard.
You covered everything. I'll just summarize by saying indoor activities, particularly indoor activities with more people, and any indoor activity where face coverings have to be removed for any portion of the activity are the events where we likely target first, because those are the highest risk events. But as the county executive alluded to, we do get a report on contact tracing and the higher risk activities, working outside the house, family gatherings, indoor and outdoor dining, retail are the highest risk events and categories, and would likely be the place where we would target to have the greatest effect. And it may not always be a closure of those in whole or in part, but it could be additional restrictions in terms of capacity limits and other things to address the uptick in cases that we see moving forward.
Thank you, gentlemen. And that was the last question from members of the media. Any more questions? Going once? Going twice? Okay, well, thank you. Thank you for joining us today. I think we're done for the afternoon. Thank you, everybody.
Thank you.
Take care.